is Powering the Movement, a Global Citizen podcast, and I'm Madge Thomas. In this show, we're sharing inspiring stories from people in our movement of engaged global citizens. They live around the world and are committed to ending extreme poverty by 2030. On this episode, how something as simple as a text message can mean the difference between life or death during a pregnancy in Cameroon. Alain Nteff was a 20-year-old college student studying engineering when he travelled to a rural village in his home country of Cameroon. He wanted to spend some time with his longtime friend Conrad Tanku, who was working at a medical practice. The visit changed his life.
Basically, when I was visiting the rural area where he was doing his integrated medicine, that week he had lost over 70 premature babies. I was like, come on, it's 2012. But there's so much technology. Why do we still have this problem of maternal mortality?
These deaths were shocking to Alain, but what he witnessed represents a larger problem in his country. In Cameroon alone, 20 women die of pregnancy-related causes every day. 50% of the world's maternal deaths occur in sub-Saharan Africa. In West Africa, 225 women die every day while giving birth. Most of them live in poverty. This is one of the reasons Global Citizen campaigns vigilantly on maternal health. But here's the thing, many of the conditions that cause deaths during pregnancy could actually have been prevented with appropriate prenatal care and preventative health checks before a woman is even pregnant. Alain realised this, and he saw a solution to encourage prenatal care. He created a simple way to remind expecting mothers of their doctor's appointments, all from a cell phone.
So at that time, we had to propose a simple solution that my friend, Dr. Conrad, could use to remind his moms when they come for antenatal care. After building the solution and deploying, the initial success was really good. And the question was, why can we not just scale this to reach every other pregnant woman?
So they scaled. And in 2015, Alain and his friend Conrad co-founded GiftedMom. It's a social enterprise that connects expecting mothers to medical care and information.
So GiftedMom offers 4 services today. The first is our SMS reminder service, which provides appointment reminders to pregnant women and mothers with babies for vaccination. This has increased hospital attendance by up to 95% in hospitals where we work. The second solution is our mobile app, which provides more visual, lengthy content for mothers during pregnancy with a mom community and access to a doctor. The third solution is our fast-track services in hospitals where women using GiftedMom don't have to spend 5 to 7 hours waiting for care. They are being received and treated in under 30 minutes. The fourth solution is our healthcare finance scheme where in rural areas we identify moms who can afford care, and we actually pay for care, lab tests, consultation, and even delivery.
Appropriate prenatal care can identify risk factors and conditions that can complicate birth. The World Health Organization recommends at least 4 visits to the doctor throughout a pregnancy. I remember I had around 20, and that was for a minor complication. But lack of access to medical services, information, and of course, lack of money prevents women from taking action to protect the health of themselves and their newborns. GiftedMom bridges that gap for close to 200,000 women who use its services. Their service easily fits into the day-to-day life of an expecting mother.
GiftedMom today is really every mom, but 40% of our users are really like in the rural areas where we do SMS messages. We also do like vocal voice messages recorded in local languages. Today we have Pidgin, we have Fulfude that are pushed to their phones because the literacy level isn't that high. The rest of the other 60 is really moms in semi-urban and urban areas. These moms come to our hospitals in Yaoundé and Douala. They receive the SMS service. They can also download the app because the smartphone penetration is really growing across the continent. And also the fast-track moms are really moms that are either working or they're teaching or they have kids they have to pick from school and they can't really like spend 5 hours in the hospital waiting for care, or either they're heavily pregnant and just waiting there for 5 hours is really not the best thing for their pregnancy.
GiftedMom has helped expecting mothers realise when a symptom is normal or if it's time to go to the hospital. Users can text doctors their questions when, for example, they have a bad headache or they're spotting blood. This is especially helpful in rural areas when the nearest hospital is often miles away.
We have an example of a mom who is sitting, she has not felt the baby for like 2 hours or 3 hours or 5 hours, and she doesn't really know that it's a danger sign. Or you have a woman that has been having severe headache for about 2 weeks during her pregnancy. She doesn't know it's a danger sign. So we really come at that level to educate them on some of these danger signs so that once they have it, they can get to the hospital. We also provide them doctors 24/7 so that if there's any emergency, they can make a decision to seek care. 30% of the questions we get today at Gifted Mom are danger signs. So it means that we can timely detect if a woman is at risk from the questions she asks and refer her to a hospital.
The issue of maternal mortality also stems from a shortage of trained medical professionals. According to the World Health Organization, Cameroon has 2 doctors for every 10,000 people. Compare this to Germany or France. These countries have 110 doctors for every 10,000 people.
Just 15% of moms have access to a personal gynecologist during their pregnancy. The rest have to share one gynecologist. So you see like 1,500 women sharing the same midwife, sharing the same gynecologist. This means that the time spent per woman is really limited. And the midwife or the gynecologist cannot really identify the issues if he's doing a consultation for 5 to 10 minutes. So there's a lack of personnel to attend to a mom.
Even better, those who live in rural areas can rely on Gifted Mum to bring them closer to faraway hospitals. For example, in northern Cameroon, there's an estimated 1 doctor for 30,000 people. Gifted Mum helps bridge that gap.
This delay is really faced like in rural areas where the proximity to a hospital is not really close to the user, and there may be the problem of transportation. We've invested over $70,000 of our own cash to finance healthcare in rural areas. We're financing everything from funding health personnel to go into the communities and seek women that have complications or have not visited the hospital during their pregnancy. They bring them to the hospital, and if they don't have the means to pay, we fund everything.
Another issue in maternal health is getting quality care when the expecting mother needs it. Gifted Mum fast-tracks patients at hospitals so they don't waste hours in waiting rooms when a baby is on the way.
Today, we have cases of if you're in a rural area, you arrive, the specialist is not there. If you're in an urban area, you arrive, there can be so many women, you have to spend 5 to 7 hours in the hospital. Here, we've implemented our fast-track service where a mom comes and in 30 minutes she's been received rather than spending 5 hours in the hospital. The third delay is before we entered some hospitals, we had cases of women coming to deliver, and because the midwife on call has worked all night, she's really tired, and she tells the mom, she doesn't really take the time to check the dilation of the mom at that time, and she says, no, you're not yet ready for delivery. Meanwhile, the woman is ready. And it's only when the baby already starts coming out that the midwife knows, hey, I need to start taking care of this person. So there's a problem of availability of personnel. Then there's also finance. Today, once you don't have a lot of cash or insurance, you access care in like public or mission hospitals, and it's been known for like not the best care. So we are really coming with our fast-track services to upgrade the services of such hospitals.
Even with all the roadblocks to maternal health, Alain sees a way to improve lives and the health of his country. From that first visit many years ago, he has ambitious goals for the future of Gifted Mom. He is a finalist for Global Citizen's Cisco Youth Leadership Prize.
The Cisco Leadership Prize it's a huge opportunity to showcase what we do at Gifted Mom. But also it's another opportunity to inspire young people that we can really be part of solving local problems. And thirdly, it's going to give us the resources we need to really go out there and reach the moms that need our solution the most. If we're awarded the prize, we want to invest 50% of the prize money in scaling our SMS solution to reach many more moms. And the other 50%, we want to finance healthcare for mothers who can afford. My commitment to ending extreme poverty, my focus is really around health, making sure that pregnant women and mothers have access to healthcare. And today we are starting with moms across different channels, but going forward, our focus is really to invest in financing healthcare for moms in rural areas, especially those who can afford.
One thing we haven't talked about is how technology can be a solution to global health issues. In this case, technology is a solution to preventable health issues for women. But first, Alain says young people need to take action.
My message to other young people on getting involved with the issues that affect their future is really to put skin in the game. We are living in a very exciting time where access to knowledge is very accessible now with the internet. A lot of these problems that we have are within our skill sets. We can actually solve them. Access to capital is easier today than 10 years back. And with skin in the game, we can really mobilize all the resources we need, all the talent we need to start solving some of the issues. We've been complaining for a long time about the government, about colonization, but we really need to put skin in the game and start solving some of these hard issues. Ending extreme poverty is a humanitarian problem. Today, I don't see any other problem I should be excited about, rather than focusing on making sure that health is accessible to anyone, no matter your socioeconomic class. So I believe if we can solve this for moms during their pregnancy, we can really extend this to make sure that health is accessible for everyone, independent of your socioeconomic status.
The winner of the Cisco Youth Leadership Award is being announced this month, so you can head to our website, globalcitizen.org, to find out if GiftedMom won. While you're there, you can check out stories about other changemakers like Alain and his friend Conrad. To hear more about GiftedMom, visit their site at giftedmom.co, and you can start taking action to support maternal health today in the Global Citizen app. If you want to share Alain's story, please send this episode to a friend or help others find this podcast by rating and reviewing Powering the Movement wherever you're listening. It really helps the cause. I'm your host, Madge Thomas. Powering the Movement, a Global Citizen podcast, is a co-production of Global Citizen and Kindred Media. Danielle Roth produced this episode, and it was scored and mixed by Brad Stratton. Sandy Smollins is our executive producer. Chris Peterson is the executive producer for Kindred Media. Cassie Carruthers is the editor-in-chief for Global Citizen. Special thanks to Kiki Morty, Matt Petronzio, Rafe Payne, and Ali Mish.